Hermann PMD, and I'm the head editor of the second version of the T-Scan Research Handbook to be published by IGI Global. My background is I'm a prosthodontist by degree. I trained at Tufts University School of Dental Medicine from 1980 to 1985, and since then I've been in private practice as well as in continuing education, and I'm the longest standing user and researcher of the T-Scan technology. After the first research handbook, which came out in 2014, there's been new research, there's been new advances in the technology. For example, things like the digital overlay, which has recently come out, T-Scan 9, T-Scan 10, and enhancements that the software has undergone, as well as some of the other technologies that we collaborate with, the bioresearch, EMG, and joint vibration analysis, and jaw tracking, all of which we use. And so not only have the technologies been updated, but the research that we've done, new publications needed to be included. And so after a few years since the first book, it became necessary to create an additional content that brought the reader of the book up to date with today's final research publications that we've been able to publish up until just, I would say, the beginning of 2019. The overall goal is to educate the dental community that digital occlusion is a significant advance in patient care, and to open the eyes of the dental profession that measuring the occlusion, treating with measured metrics and high precision standards greatly improves outcomes. And that's in all disciplines. That's in implants, that's in bridge work, that's in TMJ, that's in doing prosthodontics, that's in making occlusal diagnoses, that's in educating the patient. And so the T-Scan technology, which is the main technology discussed in the book, is itself a major advance over the articulating paper method and the dentist using subjective assessments in determining occlusal function, and all of which can be greatly improved by the T-Scan technology. So the book's goal, and my goal as head editor, is to educate the dentistry that there's a much better way to treat patients occlusally and a much better way to diagnose occlusal problems when you use measurement with the T-Scan technology.
I'm John Radke, the chairman of the board of Bioresearch Associates, and I've written the chapter 5, which is the role of biometric instrumentation, particularly in the area of temporomandibular disorders. There are some new areas in chapter 5, and of course in the other chapters, about a 50% increase in the total volume of what is being presented. In my chapter 5, we have added some additional areas, primarily in the evaluation of masticatory function and in the role of the biopsychosocial element that's involved in TMD. Well, the research is helping dentists to help patients that have temporomandibular disorders. And we're reaching now more than 30 countries around the world. And so I would say it's having a rather sizable impact specifically in that area. The research is also applies, at least some of it, to ordinary dentistry. Prosthodontics, orthodontics, and so on, implants, that sort of thing. So to a certain extent, it's also affecting those areas.
I'm Dr. Ray Becker. I'm from Ellicott City, Maryland, and I'm honored to be here at the Bioresearch Annual Conference. And I just wanted to enlighten people to the chapter that I wrote on joint vibration analysis and diagnosis of TMD and the upcoming book, research reference book that Robert so generously invited me to participate in. Well, the interesting thing about the chapter that I wrote was to enlighten people as to the process for the diagnostic process and the use of biometric technologies to enable us to get a better diagnosis, and how that impacts the patient's care and some of the concerns and issues that we run into every day. So it allows a simplified model to analyze and diagnose and evaluate patients with TMD disorder. There's a lot of stuff that I added to the chapter, mostly on the diagnostic process and how to employ these technologies to help us better attain a working and differential and definitive diagnosis for the patient, instead of just doing it by the limited means that we had used in the past. It's done quite well in the sense that, from what I hear from IGI, it's a very popular textbook chapter that they are able to download, so apparently it's been quite well received in the sense of its importance as part of the entire role of using these technologies to diagnose and evaluate our patients. So it gives a very clear model. A lot of people who have read the chapters have reflected back to me that it's very readable, it's very understandable, and it's very descriptive in terms of flow. It's very straightforward to understand how it works. So I'm glad to be able to have written a chapter on the joint vibration analysis, which is practically, there's not many that are specific to that technology. So I'm really happy that it's enlightening people to the benefits of that technology for diagnostics.
Hello, my name is Hermann Lerner. I'm a general practitioner from Germany. I am currently the president of the Digital Dentistry Society International. I am delighted to be able to publish a chapter in Robert PMD Handbook for Digital Occlusion. My role in that book is to introduce and to illustrate the parameters of the digital occlusion generally in the digital workflow in full arch reconstruction on implants. Occlusion on implants was always a stepchild, actually, in dentistry. On the other hand, the digital implant dentistry, navigation, and all the digital workflow is also a new kid on the block. Now is the time that the digital occlusion should go into that digital workflow in a harmonious way, in a validated way, and this is how I see my role through this article. Generally, in full arch reconstructions on implants, we talk about and we aim to perfect aesthetics and a challenging perfect function. I hope that my chapter will bring new data concerning those parameters. Introducing the digital occlusion through T-scan in our daily digital workflow in full arch reconstructions on implants, I hope that it will be a motivation to digitalize completely the registration, the check, and the adjustment of an occlusion in the complete digital workflow. Thank you.
My name is Dr. Patrick. I'm a private practitioner in Dieppe, New Brunswick, at the Dental Health Center, and also an affiliated professor at Keele University School of Kinesiology. The chapter explores the relationship between occlusion and posture through various measurements using biometrics, namely T-scan and mobile map. That relationship is also demonstrated through clinical cases. Since the profession doesn't really have a good understanding of occlusion and that relationship with posture, the chapter illustrates thoroughly some of the literature that is existing, but also some of the data and the values that are recorded through biometrics. I think it's going to change the perception of dentistry, and also it's going to open new avenues for more research and a better understanding of the body relationship, notably occlusion and posture.
My name is Ben Sutter. I'm a chapter author in the book. I have a private practice in Eugene, Oregon, and I do use T-scan in my general dentistry practice, but mainly am known for using it in the role for DTR and treating pain patients. I have a pretty unique chapter in the sense that the patients that came to me had already been diagnosed with something other than what we would normally consider an occlusal, something other than an occlusal diagnosis. In other words, the patients who suffer from trigeminal neuralgia, Meniere's disease, cervical dystonia. And so the fourth one really isn't a medical diagnosis, but it's called phantom bite, which has previously been kind of viewed as a somatic disorder and not really an occlusal disorder. And once you use T-scan on these patients, you see that there are areas of the occlusion that can be corrected, and miraculously, when you correct those things, patients get better. And so one of two things either occurs. Either they were misdiagnosed, or I'm a miracle worker, which is probably the first one. And it lends weight to the power of occlusion, and unfortunately sheds light on an unfavorable aspect of dentistry, that we don't all agree on what occlusion is or isn't, and also that we should be measuring, because these patients were willing to do some pretty outrageous things when really all they needed was their bite adjusted. So that's what makes this chapter unique. I think it's changing the entire profession in the sense that it's giving patients hope where hope did not exist before, in the sense that, well, you have this disease process, well, we just treat it and good luck, you can take meds for the rest of your life, we can do some surgery, which is pretty good, but we really don't have anything else to offer. And so as a conservative treatment, it's almost like working on a car. You do the most conservative things first before you start doing neurosurgery. And so this being a conservative, non-invasive procedure, which probably many more people suffer than we even know suffer today, and could benefit from having the procedure done. To what extent, you don't know without measuring, but what's noteworthy is looking for another etiology for trigeminal neuralgia, Meniere's disease, cervical dystonia. It's not to say that the bite is the only etiology, but it is definitely a contributor, minimalistically. Otherwise, it really wouldn't matter what I did with the occlusion. Patients wouldn't get better. And so what you see is patients that were diagnosed with specific items from multiple doctors in that specialty, and then when you correct the dental problem, these patients got better. And so TMD is a very wild chameleon in that it can look like a bunch of different things. So I think what my hope is that this allows us to treat our patients with more objective data and less politics.
It's the only, combined with the first research handbook that came out in 2014, these two books are the only compiled textbooks on digital occlusion and the associated technologies that digital occlusion complements. And there are no occlusion books that talk solely about digital occlusion. There are no TMJ textbooks that include the value of digital occlusion. There are no implant textbooks that talk about how digital occlusion helps the implant restoration survive and not break. And so this is these two books are the only compilations that talk about how digital occlusion has a huge impact on dental medicine. And as I said, as a field, it's evolved over 35 years, but it hasn't necessarily made it into academia. So these two books, the first volume, first handbook of research, and the second one are all the foundation literature for the future of occlusion, because the only way to practice it successfully is with digital metrics. It's too subjective a field that it has to move into the digital world in order to help patients come out, have better outcomes, and have dentists stop struggling with occlusion, because dentists struggle terribly with occlusion. So the importance is that it will educate dentists as to a much better way to get occlusal analysis, occlusal diagnosis, and to perform occlusal procedures with high precision which to date has only been done if you use the T-scan.